Brittany. I'm just going to walk you through how to break down a room properly. Granted, at the Avon office, the operatory may look a little bit different, and it is different every procedure, but the gist of how to do it properly wearing the right gear is important. So definitely, obviously, you're going to want to make sure you have clean gloves on. Every headrest should have a barrier over it that you can put the trash in. You want to try and make sure all the trash is put away before you take the dirty tray into the sterile lab. So whatever needs to stay in the room, you'll keep in the room and you'll spray with Cavicide. And all the trash you kind of just gather into the trash bag just to get rid of everything. Hand pieces will go, everything that's kind of set up out here. You'll want to take your glove out, the barriers. These don't get sprayed with Cavicide. You do have to use an Optum wipe just because of the material of the tray, you want to preserve it. Grab all this here. Okay. So then everything on this area does get sprayed with Cavicide. You want to make sure you avoid the holes of the hand pieces. It can mess everything up in there. You want to take your dirty glove off because it is in the cabinets here and these are considered clean. You'll grab the Cavicide. You'll kind of give it a good spray. You don't need a whole pile of 4x4s. 2 should be plenty. You'll saturate it. You'll go and take your tray into the sterile line and then we'll come back and clean it. Alright, so we're back. We've been letting this Cavicide sit here for about 3 minutes. We want to make sure it does sit for 3 minutes just to get all of the bacteria and germs that have been sitting here. So you'll just grab these 2x2s and just wipe everything down. Again, when you sprayed it, you want to make sure you didn't get in these holes, but it is important to wipe every crevices and the cord that extends down just because you never know if something dripped or if you touched it with a dirty glove. Kind of all these areas here. And these do stay in the room. It's just to kind of hold the bib, but you want to make sure you still clean it even though it wasn't in anybody's mouth. Okay. And then keep your gloves on. You'll grab a Optum wipe to wipe down the chair and the light. Again, you want to use a wipe just because the Cavicide is too powerful for the material of the chairs. Anywhere that your dirty glove may have touched here, and on these lights here. And then I always make sure to clean off the doctor's chair and the assistant's chair. You dispose of your gloves and just make sure to put proper barriers on the headrest and the lights. You want to put the tape long ways because this is where you'll touch the lights when you need to switch it over. If you just put it over the handle, that's unprotected. You'll put it down here where we use a dirty glove to lean them back or forward. There are 2 on each side, 1 on each side. And then a headrest cover.